Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Welcome to the wonderful world of wellness. I want to send my best wishes to Bill and Anita. I hope everything turned out okay. I know he's improving, and I appreciate your daily texting telling me his progress. Hope to see him soon back home. We all love you and we miss you. For the audience, we are so happy to have my new addition, my new colleague that have joined the AGI family, Dr. Amy Ruskin. Amy, welcome to the program.
Thank you so much.
So happy to have you here. When I started my practice, Amy, I had to do everything. I used to cut the nails of the patient because I go to a podiatrist. I'm not going to no podiatrist. If you cannot do it, just leave me alone. And the nail will be turning back into the skin. I said, no, I had to get the equipment and do that. And I used to do the gynecological exam and all of that. So when you and I connected, we said, wow, I'm going to have a gynecologist in the practice. It brought so much joy to me because, the baby boomers, they tend to neglect themselves when it comes to the gynecological exam, and as well as the geriatric patient, So starting today, on Saturday, listen to this, we're going to have a gynecologist working on Saturday. It doesn't get any better than that. So welcome, and I wish you the best of luck, and I'm sure the patient is going to love you.
Well, thank you so much. It's my pleasure to be here today and to be part of AGI. And I do agree with you. I think that for women, generally, you're going to be going to the gynecologist when childbearing is a concern, when you're going through pregnancies, certainly for birth control and contraception and things like that. And so women in those situations are just more likely to have regular GYN care. And then sometimes as women progress through menopause and other life changes, sometimes that's why their regular GYN care will kind of fall by the wayside. It's not primarily in their minds anymore if you no longer need birth control, if you're done having kids. But I think it's still a very important aspect of healthcare in general for women to go for their gynecology care, whether they're going through some changes related to menopause or even some of the many changes that occur afterwards.
Okay. And even, a lot of the baby boomers, for one reason or another, they have no insurance. Even if you don't have insurance, they can come to AGI and make an appointment with you and get a examination done just for prevention's sake.
Absolutely. And when you mention that, especially if just to check in, it doesn't have to be, or hopefully it's not because they have some major problem or symptom. It's a good idea just for their preventive care and their overall wellness care to be seen by a GYN. And I'm happy to provide that service at AGI.
Yeah. And, sometimes there are a lot of female out there that they're single mom. They live alone. They don't have a partner. And they say, if I don't have a partner, I don't need to get checked. That's a big myth that we need to bring out there.
I would say so, because if women, are sexually active and with a partner, obviously that can bring up certain concerns and situations, whether it's related to sexual function, whether it's related to the potential for infections or other type of symptoms. But even if that's not the case, certainly just for your regular wellness checkup, to have your pelvic exam done to make sure everything is okay and to have regular screening care, I think is just part of your overall wellness. And it does make sense no matter what your, lifestyle status is.
Exactly. Yeah. Prevention is prevention, and you don't have to have a partner to take care of yourself.
Absolutely.
If a woman is going to perimenopause, what age a woman will expect that?
Well, there is a wide range. I mean, there's many, I would say the average age for menopause in this country would be around age 51. But there are so many symptoms and individual variations that may precede that. Women may get hot flashes, their periods may become irregular. Clinically, we would define menopause as no periods for 1 year. However, there are so many symptoms that can occur before that, during that, and after that, that there's really no one-size-fits-all type of criteria. So if people are having symptoms or having problems, then we would definitely want to see them and have that evaluated to see if there's anything that can be done.
Now, sometimes, in my experience, I have seen females that will come in and they say, I stopped menstruating 6 years ago, but suddenly I started bleeding again. Is that a concern?
That is definitely a concern. Now, it may be something completely benign and easily treated, or it may well be something that requires no treatment. However, in certain cases, it can indicate a significant problem with the uterus, with the lining of the uterus, or with other important structures. So that is definitely a need. That type of symptom definitely needs to be evaluated. And there are different types of testing and evaluation that can be done based on the individual circumstances of that patient.
And we're lucky to have the ultrasound equipment at the office. The transvaginal ultrasound can be very informative, I suppose, in your profession.
Absolutely. I think that's one of the most important tests for any type of postmenopausal bleeding. In the example you gave, if someone hadn't had their cycle for 5 or 6 years and then was all of a sudden to have bleeding, that would require evaluation. And I think a transvaginal ultrasound in particular can be very helpful. One of the things that can be measured on that ultrasound is actually the thickness of the endometrium, which is the lining of the uterus. And that can really help us to determine whether or not there's a problem going on inside the uterus or not. For example, if the lining were thickened above a certain level, that can sometimes be correlated with certain types of problems in the lining of the endometrium, which would need to be evaluated and treated, which they certainly can be, but we have to know that that's what's going on.
So therefore, if you're going to go into any type of hormone replacement, it would be wise to get your endometrium checked.
Well, that's an interesting thought, and I think that would be useful. For example, since certain types of hormones that are used commonly for hormonal supplementation or hormone replacement, such as estrogen, can thicken the lining of the uterus. Now, it depends on the length of times these are used, it depends on the dose, and it depends on the type of dosing. For example, sometimes hormones are given together, and that can thin out the lining of the uterus and prevent thickening. But in certain situations, hormones can cause thickening of the lining. So if, for example, a woman were to already have a thickened lining detected on ultrasound, then you could either reevaluate whether or not they needed the hormone replacement or whether it was, wise to start or continue that. So I think those type of things can all really help make the decisions of what is best for any particular patient. It's all really useful information to keep the patient safe, but to make them as symptom-free as possible.
Excellent. One of the, when I trained, I remember I graduated in 1988, and when we used to do the gynecological exam, the rectal exam was part of the gynecological exam, but that's not so anymore.
Yeah, in most situations. So first of all, it's never the patient's, the exam can be unpleasant in general, and it's never anyone's
So like I tell my patient, I joke around with, and I say, I put on the glove, I say, one last thing before you go anywhere.
Right, just when they thought they were going to escape. And certainly there is useful information that can be obtained from that. If there's a rectal mass, for example, and sometimes after the exam, that can be checked for blood. However, there are really more accurate ways of screening for colon cancer. And in some situations, when patients had undergone a rectal exam as part of a GYN exam, they would just presume that they had been screened for colon cancer and then not follow up for screening such as colonoscopy. So I think for the most part, in certain situations, rectal exam might be necessary during a GYN exam, depending on position of the uterus or particular symptoms. But I would say overall, it is not an essential part of a gynecology exam at this point.
One of the subspecialty, I guess, is underutilized is the colorectal surgeon. Unfortunately, they get called in when things are out of hand. But I use it a lot in my preventive lineup of care.
Yeah, and I think that is a burgeoning area, just in terms of people's function, in terms of continence and fecal incontinence and the way the nerves run in that area, that can cause certain types of dysfunction. And so it's really, I think what is best for patients is a more collaborative approach where all these specialties, which can sometimes be very separate and segmented, but when we all work together really for the benefit of the patient and see them as a whole, I think that really leads to improved care.
Mm-hmm. Talking about the cleanliness in the female, sometimes, a female will wear a pad and they are concerned because they notice a discharge on their pad. What does that tell you as a gynecologist?
Well, sometimes really that triggers a need for further evaluation. There are so many different things that can cause that type of symptom. Sometimes it can be something as simple as almost like a contact dermatitis. People can get irritation from the pad. Let's say many women have some slight issues with urinary incontinence when they cough or sneeze, and they find themselves wearing a pad. The pad can retain some of that moisture. Sometimes that can cause subsequent irritation and discharge. So sometimes it's as simple as treating the underlying problem that can improve that symptom. However, sometimes a vaginal discharge can be related to a type of infection, and that's easy enough to evaluate as well during an exam. Certain tests can be done to better define what's causing the discharge. Is it an overgrowth of yeast? Could it be an overgrowth of bacteria? These have different treatments, but it certainly can be treated. In some cases, women may have what's called a physiologic discharge. Some people just secrete more in the way that some people sweat more. Mm-hmm. So the point is it may be something that requires treatment. It may not be. But really the issue is to get it evaluated. So
especially if that discharge is like a dark chocolate or dark coffee discharge.
Then my concern would be, is it a discharge or is it actually bleeding?
Bleeding, exactly.
So these things can all be differentiated based on subsequent testing, and then we can know how to best serve the patient.
So for the audience, Dr. Ruskin is not having the discharge. You should monitor the color of the discharge and the quantity, what's the volume.
Yes, and I also think monitoring any sorts of triggers, just like any other symptom. If it occurs in X situation or Y situation, then that can help us narrow down the cause and the treatment.
Excellent. And we are talking to Dr. Amy Ruskin. She's a gynecologist and obstetric. We're going to be doing, I guess, gynecological, even though we do internal medicine. So who knows? We might be jumping into obstetrics soon.
As technology advances, many more things become possible.
Exactly. And you can call the office at 954-489-1345. Again, she's going to be working with us starting today, Saturday. It's going to be her first day. She already have a full schedule. So I know a lot of the patients are excited to know that we have a gynecologist on staff. So a lot of the men listening, because this is Pencil Talk Radio, take notes and discuss with your loved one. And, a lot of females, they want to have a female gynecologist to examine them. So there you go. It doesn't get any better than this.
Thank you.
You're welcome. So another myth with gynecologists. Patients, sometimes they say, well, if I just go and buy over-the-counter hormones, then I don't need to get checked, because if it's over-the-counter, it must be of very poor quality or, very low concentration, and I should be okay doing that. Since I'm not a woman, I won't ask myself that question. But
Well, I think that is a misconception in the sense that if you don't need a prescription for something, that it can't possibly harm you. And I would have to disagree with that, because I think some of these preparations, some of these supplements, they can be quite strong. And I think you have to be aware of that and be wary of that. Another concern that has come up among physicians and patients are, do we really know what's in these supplements? They're not always as, say, well controlled across the board. There may be some that are very vigilant about what goes into their product, and there may be some that are less vigilant about what goes into their product. So I think, again, on an individual basis, you have to be careful about what you're using and just be aware that it may be more potent than you think.
Exactly. And it's like, you know, a lot of the supplements that are out there, a lot of the vitamins and supplement that people get out there, you know, they go by the heading, and they don't go and research and look where was this product manufactured at, and how what's the quality of the product that you are having. So you can have in something that is of a very poor quality.
And I think that's a presumption. I think sometimes people assume that these products are monitored in the same way as a prescription product is, and I don't believe they are. And that's not saying that there can't be some excellent, well-researched,
Absolutely.
well-made products, but it's just, I think, very difficult for a consumer to tell. It's difficult for me to tell as well. You can't always tell about the sourcing, the manufacturer, what degree they're inspected, what the quality control is. And I think it's really important because these can have significant effects on our physiology in all different areas. We're speaking not just for women, but as you mentioned, for supplements that
in general
guys take for a variety of reasons.
Exactly. There was recently one of the chain of pharmacy have to pull out a product with supposedly has aloe vera.
Yes, I think, I can't remember which major pharmacy chain it was, but I think when their product was tested for aloe vera, I believe it contained very
Zero.
little or zero.
Or zero.
And that is an issue. Now, certainly these things can happen sometimes even with a prescription product, but I think that the FDA tends to be more vigilant about it. Now, you know, that can result getting everything FDA approved and everything monitored as a pharmaceutical type of product. That adds a lot of cost to certain things as well. But really, like with most things, there has to be a balance, and there has to be a balancing test between the cost of something and the quality, as well as the inspections, so we know what we're getting as consumers.
Right. And, you know, and when it comes back to hormone replacement, for both men and women, some people go to compounding pharmacy, and it's all about the technician doing the compounding. The mixture can be disproportional to what you would recommend or what the FDA have accepted as being the norm. The consumer need to be cautious with that, you know, because it's come from a compounding pharmacy doesn't necessarily mean that what you get in this month is what you're going to get next month. It can be totally different. So that's...
Yeah, that can be problematic too. Now, of course, there are going to be some pharmacists and some compounding pharmacies that are really at the top of their profession with and have impeccable accuracy and processes and procedures in place to give a consistent product. On the other hand, you'll have other situations where that can't be confirmed or verified, and where the percentage of the product or the quality or even the sourcing of the product may vary. And so then you really have to trust in your physician and your healthcare provider as to what they recommend and where to get that product.
Oh, beautiful. Amy, you know, sometimes the patient are kind of shy to talk about their libido. When you have a person, let's say, that had been by herself for a number of years, and suddenly somebody is coming into their life, and all those fears come up, you know, do I have vaginal dryness, you know? So Dr. Ross, can give me some of the things that you encounter in this topic?
Well, I've been in private practice now for about 20 years, and I would have to say I'm happy to say for whatever sort of social or societal reason, it has become much more acceptable to discuss these type of things. And I'm glad to see that, because otherwise I think people suffer in silence, and maybe it's improved by access to the internet, so people at least can, contact people of like mind and see what they're going through. But I think there are many women with concerns if they haven't been active for a period of time and are becoming more active, or if they have the symptomatology you mentioned, like vaginal dryness. There are many things that can be done to alleviate the symptoms and to put their mind at ease. I think that's another thing, just circling back to where we started about women not neglecting their gynecology care. I think that is something that, we can work together to make sure that that is not an issue for them. There are many treatments that are designed to improve those type of problems. But again, it really depends on what their specific situation is. There's no one right treatment for everybody. But I think it really is in their best interest to at least come in, be seen, and get started so that they can, enjoy this part of their life. There's no reason not to.
Exactly. And do you, when in the assessing the patient, is there any particular medication that they might be taking from another physician that would be of concern to you?
Well, there are many different things that can interact with medications. It's always a good idea to, bring a complete list of your medications, even if you're taking supplements, which, as we spoke about a little bit, sometimes people don't necessarily include those as medications.
Right.
But sometimes they can interact with other things. So I would always want to know what medications they're on. But sometimes if people have had a history of embolus or blood clots or strokes or signs, for example, of blood thickening, then sometimes that's a concern for certain hormone replacement or certain types of systemic or orally taken hormone replacement, because those can thicken the blood in certain circumstances. So sometimes that would have to be tailored to a particular individual, what the best thing is. Another thing people may not realize is that there are non-hormonal treatments. For example, for vaginal dryness, there are a number of non-hormonal over-the-counter products that really, instead of act on a hormonal basis, just act as a moisturizer to that area. Many women get very good relief just from that. So sometimes people are nervous about hormone use. For example, breast cancer survivors may be nervous to start hormones. And for that patient, there are non-hormonal remedies available as well.
Okay, excellent. And so, a lot of times we see patients that they develop this rash in the pubic area and in the labia, and it's very bothersome, of course. It's usually infection, or do you worry about cancer?
I would say cancer would be a very rare cause of that. It does play into the evaluation, especially if it doesn't respond to treatment. But there's a saying in medicine, common things are common.
Right.
And I think especially with the Florida weather, the humidity, the area can sometimes, especially if women have problems with urinary incontinence, there can be a lot of moisture in the area. And sometimes it's just a basic fungal type of rash. And it is often quite amenable to treatment with a standard antifungal cream, often with a corticosteroid added in to decrease the inflammation. Often that'll be my first line of treatment, especially after doing cultures of the area. Sometimes if it doesn't resolve after a treatment period, a couple weeks, that can be decided on an individual basis. Sometimes a skin biopsy can be done, and that really settles all debate. For example, if it is a cancerous process, that would certainly alert us to that going on. If it's non-cancerous dermatologic inflammatory process, of which there are a number, then we would find that out too. So a biopsy can be very useful in that situation. It's certainly not the first thing we jump to, but if a rash like that persists, then it does require standard evaluation.
And one of the mistake people make out there is they just go and say, because they don't want to go and talk about it. My vagina has this rash, I don't want to talk about it. So they go and get an over-the-counter corticosteroid and start using that, which can make things worse.
That's right. It depends. If you had just a fungal rash and you're putting a steroid on it, sometimes that can even mask some of the initial symptoms. It certainly will help with itching. It will help with inflammation. But since it's doing nothing to take care of the fungus, that's actually going to grow unchecked. And
it grows deeper into the tissue now.
That's right. And so created a big problem from a smaller problem. But I would say, as in all things, and it can be difficult, but you should not be concerned or embarrassed to talk to your doctor about these things. I mean, it is our job. And frankly, we hear about this all day long. So I think people are very worried or nervous, but they shouldn't be, because their health care is too important to have it fall by the wayside for something like that.
Now, having urinary incontinence, does that make you more prone to vaginal infection or not necessarily?
I think it depends on the circumstance. In and of itself, having urinary incontinence would not necessarily predispose someone to a vaginal infection. However, sometimes if women have, referenced earlier, if they have a lot of moisture in the area and that makes them prone to fungal infection, in that situation, I can see it happening. If they've had a certain type of surgery and there's complications from a urinary incontinence procedure, sometimes they can get vaginal infections from that. But I would say overall, no.
And fecal incontinence?
Well, sometimes if you have an increased amount of fecal bacteria in the area, that could colonize vaginally. Some women might notice symptoms from that.
So they need to maintain with good hygiene to prevent.
As always, and try to get treatment for those issues.
Okay, excellent, very good. When women, they get the rash, in my view, it's also important to check if they get a lot of those fungal infection, to make sure that the primary care doctor check their sugar level, see if they are pre-diabetic or diabetic, because diabetic patients tend to get a lot of those fungal infections.
That is so good that you brought that up, because that is absolutely essential. And if someone tends to suffer from this a lot, really in any age group, they should be checked for diabetes, because it can lead to that.
And that's one of my pride, to be able to work together, you and I as a team, to take care of this female out there that have not been seen by a beautiful, powerful gynecologist like you.
Thank you. It's my pleasure.
Thank you. If you want to call Amy Ruskin at the office, she's an MD. She's been practicing here in South Florida for some 20 years. You can call the office at 954-489-1345. We are located at 1608 East Commercial Boulevard in Fort Lauderdale, Florida. We are also at Hagen Ranch. Amy, why don't you give the phone number and location of your other office?
I also have an office in Tamarack. The number there is 954-718-7180.
So we are so happy to have Amy as part of the AGI family, and as we continue to grow, we will continue to bring her to the show to do more educational show like this. Thank you so much, Amy.
My pleasure. Thanks again.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.